Now, back pain is something many of us have experienced at some point in our lives. I know I have. And with more and more people spending hours behind a desk every day, it's important to ensure you keep your spinal health in check. If you didn't know, October is International Spinal Awareness Month, and this year there's a special focus on spinal health in the workplace. Dr. Lusanda Bomela, an orthopaedic surgeon specializing in spinal surgery, joins us now for more. Doctor, good morning. Thank you so much for joining us this morning. I'm trying my best to keep my posture as correct as possible.
Hi, Jenna. It's lovely to be here. You are correct. Posture is very important in spine, and we know that most of the spine pain and disability comes from incorrect posture.
Yeah, it was interesting for me to also find that a lot of people are actually staying absent. They are missing work. They say back and neck pain is one of the most common reasons for sick leave in the workplace.
Yes, actually globally, those are global statistics from WHO. They are saying up to about 360 million people actually miss work because of back pain. And of that, well, the higher number being that 540 million people in the world at some point will suffer from back pain. And if you have back pain, you have disability, and usually you cannot perform whatever task needs to be performed, whether it's an administrative type of job or if it's an actual manual job. So this year's theme is Move the Spine, and I think it's actually a very apt theme because it makes such a difference when you move your spine that it improves your symptoms, which then improves the turn-up of the patients or your colleagues at work. Yeah.
We're going to dive into what it means to move your spine. I can't wait to hear that. Okay. But let's start also by taking a look at why back support is important. I know that some people even wear even body shape wear to help support their posture. Does that work?
Okay, we have to actually break that down into different elements, because there's back support whereby it's things like a corset, and it usually will be reinforced at the back, so you are supporting the muscles. And then there are braces. The braces are different types according to, are they supporting the anterior muscles, the posterior muscles, or combined? And then there are just corsets, which are the garments that people will buy in the shops. Those are not usually really well supported in that you'll find that the distance between the reinforcements is not equidistant. So you have to look at, is the anterior part supported as well as the posterior? So it depends what garments they are wearing. It is good that it does correct the posture, I must say, because you find that the person is straighter, they walk up, and they don't slouch, which takes the pressure away from the lower spine. So there is some benefits. There really is.
Let's look at why doctors revere spinal health.
It's functionality. Your spine is important for your function. It's important for your mobility and as well as your agility. Why it's revered is as well as it's a major cause of disability, and it's not an easy thing to actually treat, because we have found that more than 90% of patients suffer from non-specific spinal causes, and then plus minus 10 to 15% will have a specific cause, that being something like cancer, infection, arthritis. So depending at what age you are talking about, you will find that most people, it's actually mechanical. So if you can correct that, you improve the outcome. But if you can't find the cause, that's where I then say I focus on a multimodal approach, using the allied work and medicine as well.
Now let's bring it back to the workplace. What is the correct sitting position? Hours behind a desk. I see they also say we should consider a standing desk if possible.
I say it depends on the type of work that you do, and you are correct. Quite a lot of people, about 80%, are now doing office work or desk work where you are sitting more than 8 hours a day, which is actually quite a lot because most of your weight is carried in your spine. It's actually carried in your shoulders, so your neck muscles are important, and then carried in the lower spine as well. So if you are sitting on a desk, the chair is important. So I advocate in my practice that patients must use ergonomic chairs. I have them, I show them, I give them pamphlets as well. That is a chair whereby it's similar to the one you're sitting on. There must be back support, there must be neck support, as well as it must be adjustable. It must have a comfortable cushion to support your buttocks and hip as you are sitting down. It must have wheels so that you can adjust according to where you are sitting, how you are sitting, and what you have to do at the desk. And then the desk itself is also important. The height is important. It must be above the hip level, and it must be that it is a comfortable area where you are able to then sit. Your computer, which most people are using laptops, but usually a standing computer is actually better because then the height is correct. You want to be sitting at a height whereby your eyes are level to the screen. Okay, so if you're sitting on a laptop, what will happen? You will tend to slouch because it's lower down. The level of the keyboard is also important. Your keyboard must be towards the edge so that you are not leaning forward and putting stress on your upper thoracic muscles as well. So there's a lot that you have to look at within the work environment. Then a standing desk, there's also different requirements. So I look at what symptoms does the patient have? So if the patient says to me they have got back pain, I always want to know what are the aggravating factors, relieving factors. Because some patients have pain sitting, so obviously that patient then needs a standing desk. Some patients have pain standing, then you need a sitting environment. So you have to look and adjust at that.
So much that goes into it. Unfortunately, we're running out of time, but I do want to ask you, what is it that we can do now to prevent that we have spinal problems in future? Very briefly.
So spine health is very important. I'll just touch on the core factors that you need to look at. Exercise. It's been proven. If you exercise, you decrease the inflammation around the muscles, the joints, and the ligaments, and it has a better outcome. We have found that with exercise, you also decrease the weight. Weight loss is important. If you lose 10% of your body weight, it makes a difference to the spine, the hips, and the knees. And the exercise is important. It must be weight-bearing type of exercises, as well as diet. The diet makes a difference because you want things like calcium. Calcium is important for bone strength and bone mineralization. So you're looking at things like calcium, your vitamin C, your vitamin D. 10, 15, 20 minutes outside in the sun 3 times a week makes a difference to your bone density as well. And vitamin K as well is important, and magnesium. And then we look at stretching. When you're doing your desk job or even your manual type of labor or you're a surgeon, stretching is very important. Your muscles mustn't stay in the same position at all times. That's why I then advocate for them to go to like physio. So you look at things like Pilates, yoga, that can make a difference as well as stretch aerobics, and being active is very important.
That's where the Move Your Spine comes in, I
That's
presume.
where Move Your Spine is based on actual research. Smoking. We have found that there is a high correlation between back pain and smoking. By just stopping that, you make a difference to your life.
Such crucial information. Doctor, thank you very much for joining us today. Do your research and make sure that you do what you need to do to keep your spine healthy. That was, of course, orthopedic. That was, of course, the orthopedic surgeon, Dr. Lusanda Bomela.